Okay, welcome to the tutorial Diagnostics 3 for the assessment section. This is another new feature we've added to diagnostics. There are 5 features to this that you can use in other parts of the program. I'm going to jump back and forth between prognotes so that you can see this. In this section, you have a mood symptom monitor. Basically, this allows you to answer questions for your client or have your client answer questions by downloading a form and having them fill it out, and allows you to track how they're doing with their symptoms in mood or anxiety. Now, the mood disorders, of course, include forms of depression, mania, and suicidal symptoms, or suicidality symptoms. The anxiety monitor tracks generalized anxiety, panic disorders, agoraphobia, specific phobias, social phobias, PTSD, and OCD. So the symptom checklists here are all focused on those main categories. So if you want to track how your client's doing, this basically provides 5 questions for each category, roughly a little more for mania, and allows you to kind of monitor how they're doing as they go through their treatment with you. So if you're treating somebody for depression, for example, you should see their depression scores decrease over time if the treatment's being effective or not. Now, the validity in this doesn't come from a standardization process that went on to create these questionnaires. The questions that are being asked are ones that are based upon symptoms, the most common symptoms associated with each of those diagnoses. So the common symptoms for depression that are more biological in nature have to do with things like eating and sleeping and anhedonia and those sorts of things. And it's based upon a Likert scale question or Likert scale response to each of those questions. So as clients are getting better, they're going from a most of the time, perhaps, average of experiencing a symptom down to maybe moderately or somewhat. So you're going to see improvement based upon your treatment by monitoring this way. And again, that doesn't come from a standardized test. These aren't standardized assessments. These are basically symptom checklists on a Likert scale that you should see a decrease in scoring if they're getting better. Okay, so the mood symptom monitor is basically the same thing as the anxiety symptom monitor. I'm going to run through one of these, but the other one's exactly the same. Let's do the anxiety symptom monitor. I'm going to go through and answer some of these questions real quick, just for fun. I'm not really paying attention to the questions. I'm just marking these so that you can see how the scoring works. Notice I have to scroll down through here. You have to fill this whole thing out in order for you to get a report generated. I'll show you what gets generated in a second. And again, the mood symptom monitor is the exact same thing, but I'm only going to show you one just because of lack of time and lack of space on my web server. So you don't want to listen to a 2-hour presentation. So, okay, so I've pretended to answer all of these questions. I really haven't, but let's go ahead and calculate this out. If I click calculate based upon those responses to my view of my client, what it creates is a list of scores here on how my client is. So based upon the way I responded, the client received a score of 10 out of 25, which is roughly 40% for generalized anxiety symptoms, 25 out of 25 for panic disorder symptoms, that's 100%, 13 out of 25 for agoraphobia, 13 out of 25 for specific phobia, 13 out of 25 for social phobia, 100% for PTSD, and 56% for OCD. So it gives you a visual representation as to what might be going on based upon the way you responded. Now this is helpful for 2 reasons. One, to track in your prognotes, because you're going to be able to copy this information into prognotes. And the other is to give you a visual representation to help you diagnose. This is a good way to differentiate, for example, between, say, panic disorder and social phobia, or PTSD and OCD types of symptomology. So it's helpful. Let's see. Let's do the display next. If I click on display, this is the information that actually goes into your prog notes. Now I can copy this by clicking here. Now I've copied that information. If I go to progress notes by clicking here, it jumps over to the progress notes, and let's say this is the note that I'm working on, and I go into assessment, I can paste that information in here. So let's say I'm going to put it before the 5-axis diagnosis. Let's say this is the client that I happen to be working on. So I've got the cursor in here. I go up to edit, paste. Now all that anxiety monitor information now goes into the progress note. And I can leave all of that in. I can include one category or maybe two categories. I just gotta delete that out of there. Let's say I just want panic disorder and PTSD. That's all I'm interested in tracking. I can customize this any way that I want, because again, it's just pasted in there. Okay, so I've got the anxiety monitor in there with the panic disorder score and PTSD disorder score for July 2nd. Now, as I go along working with that client, I'm back here in assessment, I can do a new one and kind of track how they're doing and copy and paste it into future prog notes so I can see a decrease in anxiety symptoms. It's a way to kind of monitor how they're doing. One other thing regarding the anxiety symptom monitor and the mood symptom monitor, so there's a little button down here that says client form. If you click on that, it goes out to the website at drlogan.net, and it pulls up a form on the anxiety symptom questionnaire. And what this form does is it gives you, the same order here. So here you are as the clinician answering question number 1, experiences constant fear. And then the form allows your client to respond. Do you experience constant fear? So one is the client perspective and one is the clinician perspective. And then the client rates themselves. What you then do is get this form back from them and enter this information in. All these questions correspond directly with the questions in the anxiety symptom monitor. So it's a way for you to allow the client to respond rather than you responding for them, if you prefer to do that. And the information gets stored in here, and you can copy it and paste it into prog notes and just make a note that that information came from a questionnaire filled out by the client rather than something you assess directly. Okay, so that's the mood symptoms and the anxiety symptoms. Next, we're going to talk about personality style, ego function, and assessment aids in the next video.